are you, Dr. Garcia? Nice to meet you. Nice to meet you as well. At first, it was more for aesthetic reasons, and then kind of as I got older, I'm not sure if it was allergies or something, my breathing just got worse and worse and worse.
Her major problem was her breathing issues. She had been an athlete her whole life, had broken her nose several times, and she had a significant collapse of her left nasal airway, so she could get no air through her nose.
It's not that I hate my nose, but I would like for it to be a little bit smaller. Like Dr. Garcia said, he wants people to be able to notice other aspects and features of my face other than just my nose.
The second issue was that her nose was crooked because of all the trauma. And her third issue was that she had a malformed, significantly projected nose with a large hump and a overly projected tip. So we talked to her about how we could address those.
So I'm expecting it to be still me. I still want it to be Sarah's nose, just better, an enhanced version.
She was very happy with what we could offer, and she decided to have her surgery with us.
Yeah, like he had me just sitting in the room with Dr. Garcia. I'm excited, nervous, anxious. Mostly excited though. I feel very calm right now, and they haven't given me any drugs yet, so that's a good thing, I guess.
We do not pack the nose. We do not break the bones. We use detailed and microscopic incisions everywhere we go where the patient doesn't see them to make significant changes in both the appearance and the function of the nose.
It's been years, but seriously thinking about it for the past probably 2 or 3 years, honestly.
You know, I want to tell you this, there's nothing routine about rhinoplasty. It's a very challenging procedure, that's why very few people do it. And they say that rhinoplasty is the thinking man's surgery. And the older you get and the more gray hairs you get, the more humbling the procedure becomes. Without doubt, it's my favorite surgery to do because you are never, ever posed with the same challenge from one patient to the next.
So today we're at 1 week, actually technically 6 days.
I know.
From a rhinoplasty that Sarah had last week.
One of the only procedures that I still take off the bandages for, that I still take out the sutures for, in fact, the only surgery I still do that is rhinoplasty. The reason is, as a surgeon, you get so involved with the patient with rhinoplasty that it's almost as if it's a child of yours opening up a gift on their birthday. And you want to be there for that moment because you want to see their excitement. I still get emotional with all of these patients. I've had patients cry that they could never believe that their nose was going to look that beautiful.
Her impression, right? That's the most important part.
Right. Oh my gosh. It's so pretty. It's so different. It's so strange to look at me.
You have to understand that the typical way that we have painted rhinoplasty in our society is that patients would have black and blue eyes and they weren't able to breathe and they had packing in their nose, and all of a sudden I've changed all that. There is hardly any bruising. There is no packing. Patients are breathing through their nose on the 3rd day. So it's made it such a pleasurable experience.